Hi class, welcome back. The second part of nield module 7 over temperature starts with the basics of how to read a thermometer. So on this particular slide, the thermometer at the top is in Fahrenheit and the thermometer at the bottom is in Celsius. And as you can see where the little green arrow indicates, the top one looks like it's about 98.2 and the bottom one looks like it's about at 37. Now to reset the thermometer, you just shake it down with the snapping of your wrist. Again, this is for traditional thermometers, not the electric ones, but you just shake it down so that the liquid gets down as far as you can get it, or definitely below where you think the patient's temperature would be. So this next slide just goes over what equipment that you need to take a patient's temperature. Now in clinic, you'll get all of your items together before you seat the patient. But of course you're going to need the thermometer, whether it's the traditional glass type mercury-free or if you use the electronic type, you're going to need that. Not a bad idea to have a tissue just so the patient can wipe their mouth. No matter what kind of thermometer you use, you'll have a little disposable sheath that'll go over it. You'll need some way of timing yourself so that you know how long to leave it in, although our little electronic ones will beep, so you won't need that if you use the electronic ones. And then you'll either need a pen or a computer keyboard to record the actual temperature. As far as the actual procedure goes, for taking temperature, first thing you're going to do is ask the patient if they've had anything hot or cold to drink in the last 30 minutes. If it's a morning appointment, most likely they've had coffee. Also, if they're a smoker, that can increase the temperature of the mouth. Now, in all honesty, by the time the patient gets to the clinic, fills out their medical history, you get them back to the chair, enough time will have passed that that's really not going to come into play. You're going to want to wash your hands. We're also going to have you wear gloves. You're going to explain the procedure to the patient. Again, if you're using a traditional thermometer, which we won't be in the clinic, but if you were, you would shake the liquid level down. You would put the little sheath over the thermometer. You're going to ask the patient to open and place that thermometer bulb just right under the patient's tongue. The book says to leave in place for 3 to 5 minutes, but do it to manufacturer's recommendation. So again, the little thermometers that we're going to be using in the clinic should beep to indicate when the temperature has been read. Then you're going to remove the thermometer from the mouth, discard the little sheath, and read the thermometer. Again, if it's a traditional thermometer, you will read it to the nearest 10th degree. An electric thermometer will just tell you, which is nice. After you read it, you're going to place the thermometer on a barrier in a safe place so it doesn't break or get thrown away. Take your gloves off, wash your hands, record the reading, and then also record any abnormal findings. This slide's pretty self-explanatory. It just shows basically how to put the sheath on the thermometer, and that'll vary depending on what type of thermometer, but basically it slides on and it slides off. Easy stuff. So this next slide seems pretty easy. You're just going to explain the procedure to the patient. However, you're going to be surprised to find that most patients are going to wonder why you're taking their temperature at the dental office. So you're going to be doing a lot of patient education when you explain procedures for really anything in the dental office, in this dental clinic. So you're going to explain the procedure to the patient just by telling them that a temperature that's higher than normal could indicate an infection in their body. That's probably really all they need to know. You're going to seat the patient in an upright position at eye level for instruction. So you never want to have the patient laying back and talking to them about how you're going to do a procedure. So be sure they're sitting up. Explain the vital signs and obtain consent. So you just really need a verbal consent. They've signed their health history consenting to treatment in our office. But you just want to say to them, I'm going to take your vital signs. I'm going to be taking your temperature, your respirations, your pulse, and your blood pressure. Is that okay if I do that? Explain how the vital signs affect dental treatment. Again, you can go into elevated temperature, could indicate an infection. Elevated blood pressure indicates hypertension. During the process, explain steps as needed by the individual patient. So if they come up with other questions, try to answer them to the best that you can. If you're ever not able to answer something, please don't ever say, I don't know. Say, I will get back to you on that. I will just go and ask my instructor. So when you're ready to take the patient's temperature, you'll just have them open their mouth and lift their tongue up, and you'll place the thermometer right under their tongue, and then have them close down around the thermometer to hold it into place. Once it beeps or the time is finished, you're just going to take the thermometer out and read it. Again, this seems pretty simple, but you do want to take care of all the equipment in the dental clinic right down to this little thermometer. So be sure that you rinse it off if it needs to. Now, again, the electronic ones, we don't want to submerge those. You may just need to wipe it off with one of the wipies. Again, if it was the glass type, you could rinse it in cold water, never hot water. You want to dry it off, disinfect it well, and then place it in a storage container or wherever it is that you're keeping it so that it doesn't get dropped or thrown away. Next, this is just a chart from your book, and it's how to convert Fahrenheit to centigrade and centigrade to Fahrenheit. The left hand column is your Fahrenheit, and then your right hand column is your centigrade. So the next slide here is how to convert a Fahrenheit reading to centigrade. You probably will not ever have to do this in the dental clinic with patient care, but it is important for you to know how to do this. This question could come up on a quiz, it could come up on a midterm or final, it could even come up on the board examinations when you go to apply for licensure. So the first thing you're going to do is get your Fahrenheit reading, so let's just say it's 94. And then next you're going to just subtract 32 from that 94, which gives you 64. Then you're going to divide 64 by 1.8. Now, I would never expect you to be able to do that in your head. You could use a calculator for that. But that comes out to 34.4. Okay, so this next slide is about how to convert a centigrade reading to a Fahrenheit reading. Okay, so now converting a centigrade reading to a Fahrenheit reading. So again, let's just say the centigrade reading is 34.4. You would then multiply that by 1.8, again using your calculator, and coming up with 61.92. Then you would simply add 32 to that, and that would give you, I have to put it down here the old-fashioned way, 39, so 93.92, or round that up to 94. So a normal adult temperature range can be anywhere between 96 to 99.6, so basically from 96 to 100 degrees could be normal for that individual. Or in centigrade readings, 35.5 to 37.5. So normal varies from person to person, just like blood pressure and pulse, and so we're just within a range of normal here. However, any fever that is over a 99.5 or basically 100 degrees is considered to be pyrexia. The definition of pyrexia is it's a complex physiologic response to the disease state, and it's characterized by a rise in the core temperature, and it activates the immune system. So now there are a lot of factors that can affect your body temperature. Just to run through them real quick, you've got the time of day, exercise, age, environment. Here's a few more: stress, hormones, hot and cold liquids, smoking, like we mentioned before, rapid breathing, that actually decreases temperature, or if you have an infection. So all of these things can have an effect on your temperature. So this next slide indicates that a temperature above 105.8 is considered a medical emergency. It is very unlikely that we'll see this patient in our dental clinic or even in your dental office after you graduate, simply because a patient with that high of a fever is going to probably be in bed or in the hospital at this point. However, if that would happen, and that this patient sits in your chair and you take their temperature and their temperature is 105.8 or higher, that is considered a medical emergency, and you should contact EMS right away and get that patient to the hospital. So for that matter, quite honestly, any temperature over 101 typically indicates an active disease process. So any dental treatment at this point is typically contraindicated, meaning we need to delay treatment until this patient is feeling better, and go ahead and refer that patient onto their primary care physician for a full evaluation. So just to recap what we went over here in this part 2, certain key measurements that provide essential information about a person's health are referred to as vital signs. So again, their pulse, respiration, blood pressure, and temperature. And then there's that fifth vital sign, smoking. For patient safety, vital signs should be measured before any dental treatment. So obvious reasons, do it before you perform any type of dental treatment on that patient, because there may be something that's contraindicated that you shouldn't do. Clinicians should follow the recommended peak procedure for temperature assessment. A normal adult temperature is anywhere between 96 to 99.6. And again, a temperature above 101 indicates an active disease process, and a 105.8 is considered a medical emergency. Okay, so now at this point, I would recommend that you go back to part 1 of module 7 and review the student learning objectives. Do this each time with each chapter or module that you read. Go back and just read through them. Make sure that you know the answers to each one of the objectives. Thank you very much, and I'll see you in class.